I'm Dr. Abbott from Omaha Med Spa. I'm a non-surgical aesthetic physician specialist. This is part 2 of a series we're shooting today. In the first part, Stephanie was evaluated for Botox and received her treatment. That was completed about 15 minutes ago, so you can see she's got a little bit of redness, but almost all of it has gone away. During this treatment, we're going to evaluate changes of aging that can be treated with fillers and address any concerns that she specifically has. I always like to start with the mid-face area. All of us over time tend to lose volume in this mid-face malar area. One of the changes that occurs in all faces is there are fat pads under the skin, and these fat pads melt away. And as they melt away, the volume drops. She does have evidence of that, so there's some nice volume here, but volume loss here and extending backwards. So the way to correct this is by adding a filler called Juvederm Voluma, and this will do a very nice job of adding some shape, contour, and volume. So it creates a very attractive feminine curve, but it also has the effect of creating a mild, subtle lift on the nasolabial and jowl area. So it's very beneficial. These filler injections are very easily done, and that filler, Juvederm Voluma, will tend to last a full year. So we will start with that. Then we're going to address the lateral orbit area. This is the lateral tear trough. She has some volume loss here. Her medial tear trough actually is pretty good, so we're going to leave that alone. Everyone tends to have sinking in of this area, and one of the big causes of it is that with aging, the bony skull remodels and we actually lose bone in that lateral part of the orbit. So we're going to restore that volume using Juvederm Ultra XC, the original Juvederm, and you'll see me injecting it by cannula technique. Evaluating further down the face, her nasolabial fold is not a concern for her, and I agree that aesthetically this does not require treatment. With the Voluma, she's going to see a little bit of a lift and a little bit of improvement of that area. Stephanie is also going to have a very natural lip enhancement using Juvederm Ultra XC. We'll do the upper and lower lip. On the day of injection, it's always going to be more red and swollen than it will appear after 2 or 3 days. She had concern about wrinkles here, which we will address with filler. We'll then do this parenthesis or smile line, and we'll finish off with some Volbella, which is one of the newer Juvederm fillers that performs very nicely in these wrinkle lines. Smile real big for us, Stephanie, and you can see with smiling that line becomes a little bit stronger and you can relax. Good. Well, I'm going to get my Voluma ready, and we'll start with the left cheek. Her skin has been thoroughly cleansed, which is very important. And I always use ice prior to injection because it reduces the discomfort. It also constricts small blood vessels so that her risk of bruising is less. There are several key points that we like to hit along here. And I'm going to do her first injection right here, tap down onto the bone, and inject. I'll go back a little bit further and drop a little bit more Voluma. So with fillers, you see volume benefit right away. And we're going to come forward and do a couple more injections. Done properly, this is not particularly uncomfortable for the patient. And we're going to come a little bit lower and go into the apple area of her mid-face. Good. And look straight ahead. So she could perhaps use more filler in this area. We're going to start off with one Voluma and see how we do. Patient experience with Voluma as it's being injected is the needle goes through the skin. Often they feel or hear a bit of a crunch, and that's normal. And they actually perceive when I'm hitting the bone, which is also where we want to be. So we'll go around and do the other side. And rest your head back a bit. Good. Stretch. Little needle pokes from your Botox still evident. Just set that ice down. Good. Excellent. One syringe of Juvederm products is 1 cc, which is 1/5 of a teaspoon. And we're going to be opening a second syringe for her to give her a full correction. So that's one syringe down, and I'll open another one. Okay. Great. Rest your head back again, Stephanie. Good. Excellent. Come back just a little bit more here. Good. And I'm going to go back to the other side too. Let's have a look. We'll just put a little pressure on there for the bleeding. Good. Normal amount of bleeding. So because we're going through some muscle to get down to that bone, it's normal for the patient to feel the area could feel almost bruised. They'll perceive that it's swollen, and when they're talking or chewing their food, they may notice that it feels a little bit sore discomfort. And those are all normal. Good. I need to add a little bit more on this side, Stephanie, so go ahead and rest your head back again. You doing okay?
Yes.
Good. Excellent. And I just want to add a little bit more further back here. Good. Okay. I'm going to have you lean forward a little bit. And that looks really pretty. I'll come over and do a little bit more on the right side. So it's giving her a very nice restoration of that volume that she has lost over time. Gives her a very feminine, attractive curvature in that part of her face. This curve down the face we actually call the OG curve. It's got a name. Not all women have it, but women who do have it tend to lose it over time. This one's a little bit more sensitive. So I'm going to keep a little bit that's left so that in 2 weeks, when her swelling is all settled down, I'll have a little bit we can touch it up with. So that's 1.8 cc's of Juvederm Voluma in the cheek area. And again, that'll last a full year. Okay. Are you ready for the next part, Stephanie?
I am.
Okay.
Yes.
Alright, so rest your head back again and turn this way and get that bleeding stopped. So we're going to work in this lateral tear trough area. Make a little needle poke, sorry. Good. And I think it is best if patients have this treatment with their eyes closed. If you feel uncomfortable, let me know right away.
Okay.
I can reposition. Let's find the right, there we are. That's where we want to be. okay?
Mm-hmm.
Okay, so the cannula's right at the top of the trough, and I'm going to inject a little bit of filler. You can see it going in. So it's elevating, a little bit more sensitive here, and there as well. Good job. Beautiful. Okay. So the beauty of a cannula is it does not tear any blood vessels, and it does not lead to significant swelling. So she will not get a black eye, unlike older protocols for treating the tear trough area. It is a little bit swollen. I do think we need to add a little bit higher up, so let's go ahead and do that. I'm actually going to use one of these other Voluma holes, if I can get in there and get up a little higher. Cannula needs a needle puncture hole to get under the skin because it's not a needle. Good, that looks really good. Beautiful. Okay, straight ahead. And then we'll do the left side. You doing okay?
I'm fine.
So on video, that looks like it would be very uncomfortable. How would you rate the cannula procedure?
Fine.
Very
You are done.
minimal discomfort.
Minimal discomfort.
Botox hurts more?
Yes.
Okay, I agree. Okay, so let that area relax for this side. Needle puncture. Good. And we'll use the same cannula. Just work her way up under the skin. If it's uncomfortable, she'll let me know and I'll reposition. A little deeper on this side. There we go. Good. I'll mold that and smooth it down. Good. And excellent. That's a sensitive area there, sorry.
Okay.
Okay. So that side looks good to me. And it'll soften and smooth down naturally as any swelling just from the cannula will go away quite quickly. Good. So we've done her cheeks, given her a nice lift off the jowl, nasolabial fold, treated the lateral tear trough. It really looks great. All right, well, let's go and do a little bit of a lip enhancement. I've selected Juvederm Ultra XC for this, and if she likes having her lips enhanced, we could graduate her next time in the future in about 9 months' time to Juvederm Ultra Plus, which could last a bit longer. Stephanie, let's get you a Kleenex just in case you get a tear reaction. And rest your head back, open fairly wide. I'll hold the ice, but when I pull the ice away, make sure you keep it open wide. And remember, steady breaths. I'll turn away just a little bit. Good. So I'm starting on what we call the vermilion border. And giving that a little bit more of a definition. Good job. A little bit sensitive right there. Good. I'm just going to add a bit more along here. Okay. Give you a little time out. Because she has never done her lips before, it's important to be conservative and not overdo the enhancement. Close together. Good. And I'm going to have you keep your lips closed together now. You okay?
Mm-hmm.
Good.
Yes.
Okay. And I'm just going to add a little bit more, but I'll inject it with your lips closed, okay? So here we go. Good. Just make that a little bit more defined. That looks really pretty. So of course it's going to be more swollen today than it will appear in a couple of days. While I'm on this side, I'm going to define her Cupid's bow a little bit more than it is currently. This is an uncomfortable injection. Sorry, Stephanie, you might need that Kleenex. Good. Okay, open a bit. Just put pressure on here for a minute. Okay, we'll switch sides. Grab the ice again. And open again for this side. Good. So that looks really pretty. Because of swelling on the day of injection, sometimes at the end of the treatment there can be the appearance of asymmetry, that one side perhaps looks larger than the other. She's doing great. I'm just going to plow ahead here and get this done for her. Okay, good. Go ahead and close now so I can see. Good. Excellent. Okay, and open a bit. We'll just smooth that down. It's just a normal amount of bleeding. Very little actually for lip injection. Good. Just doing a little bit of molding. Close together for me. She seems a little bit more swollen in the front here. And I suspect that is just swelling. But we can address that when she comes back to see me in 2 weeks. I'll define the other side of her Cupid's bow. I think the other possibility is she's going to get a bruise here. Okay, so let's get some ice on there, Stephanie. Yeah, gave you a bit of a fat lip. Sorry, that can happen, unfortunately. Okay, we'll do some lower lip. So open again, and just like that's perfect. Keep it open. Excellent. Good, very nice. And close together, good. And then open and turn this way. I'm gonna ice again. And keep it open. Good. Okay, very good. And close, good. Yeah, definitely see a little swelling from the bruise you're going to get there.
All right.
Okay, let me finish your lips. Use, oh, there's some tearing.
There it is.
Okay.
Okay. Thank you.
Okay, you doing all right?
Oh, yes.
Okay.
Yeah.
Your lips will feel large right now
Okay.
because they're numb and they're swollen. And rest your head back and open again. Good. Excellent. And in this way, just want to add a little volume going in this direction. Okay, very good. So go ahead and close. Excellent. Are you comfortable to proceed and do this other
Yes.
area?
Yeah.
Okay. Good. We'll get you all cleaned up here in a minute. It's a lot of service to have done in one visit. Alright, so I'm going to have you open just a little bit less. Good. Just going to add a little bit of Voluma in these fine lines that you have. And through here. Good. Soften that out. And then smile for me to mark real big, okay, and relax. Good. I'm using a needle that's actually smaller than the needle that comes with the Voluma. It allows me to get in a little bit easier to these small wrinkles and lines. So that does soften it out, but it's every point the needle goes in there's going to be some swelling. So it won't be as even looking today as when we're totally done. Let me switch sides, and we'll do a little bit of Volbella on this side. Open just a titch, good. A little bit in these wrinkles that bother her. Good. I'm gonna feel that. Very good. Okay, excellent. Good. And small, real big. Okay, let it relax. She doesn't have much of a wrinkle on this side, just a little bit. Good. All right. Just gonna finish off with a little bit what's left here. Do you tend to sleep on one side more than the other, or?
Mm-hmm. Yes, right side.
And I promised we would finish with the Botox in the upper lip. You probably won't feel this too badly at this point because everything should be pretty numb. And turn towards me. And there, and we're done. Okay, let's get things cleaned up for you. I always finish off with the topical arnica gel, and I do allow people to use a tinted sunscreen to cover up the redness. I actually allow that right away. Good. All right, so you are done. Thank you very much.
Thank you.
That's the end of our video.